buy at school more forgiving material for you so that you can heat it and reheat it and heat it and reheat it. Real drapey material doesn't stretch back. But the benefit of that is that it's more, it conforms better to the length, okay? So all materials have trade-offs, okay? All right, so the supplies you're going to need for splinting. Miss Rita, can you come up here?
I would love to.
Okay. So, a couple things. I want to preemptively apologize so that today, when you splint, if I yell at you, it's because I want you to have a nice product. It's not because I don't love you. Okay? All right? But every teacher and every therapist is going to have their quirks about splinting. And you're going to get all these little tips along the way, and you're going to develop your own little tips. Okay? So, I'm going to tell you about the tools and devices. You got your frying pan. When we get to the room, you'll have a big frying pan to work at. Set it to 200, 250 degrees. You have to have water, and it doesn't need to be sterile or anything. Okay? I like a little netting or a little spatula because it's going to be hot, so you got to be able to pick it up out of the water once it's hot. Okay? I'm going to keep this faster. Now, Miss Mary is going to yell at you if you use the wrong scissors. Okay? Now, I think we didn't bring our third pair of scissors. You have it? Okay. So we have 3 kinds of scissors. This is the splinting scissors. Do not cut anything else but splinting material with this. Do not cut hard material because you break the scissors. These scissors cost $100 a piece. Okay? If you cut hard material, you're going to get little, I call them jaggedy jags. Little like little sharp edges, okay, when you cut. So you got to cut soft material. Now, these are called curvy scissors. So when we make the splint, we're going to be cutting around curves. So that's what this enables you to do. So if you have a splint that has lots of curves, okay, you need that. Okay, this is used to cut splint straps, Velcro. Do not cut splint material with this because these are cheap, crappy scissors. Okay, only stuff. So if I yell at you, that's one thing I'm going to yell at you about. Okay, but it's not that I don't love you. All right. Now, this is our splint material. So what I want everybody to do is take out a piece of paper now. Scrap paper, doesn't matter. If you, were you okay doing this without? Okay. So, take out a piece of paper. You got an extra pencil or something? So, first of all, I always want you to position the person in a way that you can get to their body. If the person is here, that's okay, because you're right on. You want to be head on to the patient. If the patient is like this, and they're in the middle of the table, you're going to be like this, which is bad biomechanical. So always position the person. This is meant for their arm, and you're going to have their arm turn upward like this, okay? So position the person optimally so their arm is at the edge of the table, okay? Does that make sense? So that's going to be important. And I'm going to yell at you about that one too. be nice, but I'm sort of preemptively telling you. The first thing I always do, and I want you to do this with your friend, trace their hand. But when you trace their hand, hold the pen perpendicular. Don't hold it in this way, because the splint will end up too small. Don't hold it that way, the splint will end up too big. Before you lift their hand up, I want you to mark the ulnar styloid, radial styloid, and the distal palmar crease, DPC. I'm going to do it on the board here, Michael. And so, somebody was teaching developmental skills here. That's nice. Okay. So you trace the person's hand. Okay. And before they lift up, I always splint should go 2/3 up the forearm. Okay. So I kind of mark that. I mark the distal palmar crease, which is sort of at the MP joints right here. You could come closer and take that, Michael. The little dots on my hand. I mark the ulnar styloid and the radial styloid. See it? You got it, Michael?
Yes, ma'am. I got it.
Then you lift it up. Stay here, because this is going to be the big finish. Okay? We're going to connect the dots. Okay? And so you connect the dots at the distal palmar crease. Everybody see what I'm doing? And that's your splint pattern. Zoom in, baby. Okay? That little thumb knobby thing is going to go through the web space. Okay? Make a pattern. People like Miss Rita, who make splints every day, might not need to make a pattern. You do? Okay. Well, Chrissy, just zip, no patterns.
Some I don't, but this I do.
Yeah. So, make a pattern. So today, when you're in lab, you're going to do it on a paper towel. Try the pattern on your patient first, because then you won't waste material. Does that make sense? All right, so let's do it on Miss Rita. Have a seat right here.
How do you know how much to go in by the thumb? How did you know where to
Well, I kind of use the actual thumb.
Slip on this side
Here,
right
it's
here.
better to make it a little bigger. You can always cut back. Once it's too short, you can't do anything about that. So, good question. Have a seat. No, let me do this.
Oh,
Right
okay.
there.
Oh, yeah.
Oh, it's getting hot. Okay, so, right, have the patient flat on the table. Draw the hand. And you can come wherever you need, Michael. And you don't even need the hands. Before they lift up, you mark it, mark the styloid, mark the distal palmar crease, and then we're going to do a connect the dots. So you lift up, splint comes here, you make a little thumb bar, I don't know what you call that. Now, typically on the video, come out about 3/4 of an inch from their arm, because a splint is supposed to go up halfway on the sides of the forearm, okay? If it's too shallow, they're going to tip over the splint. Does that make sense? All right? Are we good with this, friends? Okay? So, once we get our design, we use these scissors to cut our pattern out. Now, my pattern is not long enough because of my paper, but once I get it on the thing, it's like paper dolls. Doesn't take much to amuse me. So, I always kind of try it on the patient, and I'm like, oh, I could tell this looks too wide here right away. So I probably need to trim it in a little bit here. Just sort of curve it in. You see that? It kind of should look like that. See it? Are we good, friends? So look, it's going to wrap like this. Is that everybody good with that? This is how the splint's going to be. So then I try it patient, and typically, I'm gonna go like this. My water's running out. Okay? And I say, is this gonna work on my patient? Well, that looks like it's gonna work. Okay? It might be a little wide actually on her. So I might even trim a little bit of it. Don't trim too much because otherwise you'll have not enough material. So then you go, and the other thing you need to do before you splint any patient, there's this thing called the Stockinette. Okay? If your clinic doesn't have this stuff, an old tube sock will work nicely. Cut the thing off the old tube sock and cut you a little notch out of here. You see the little notch you do? Little notch, okay? And this is a sleeve that goes on the patient so you don't burn them when you make a splint. So this goes around their little thumb there. Do you see that? Michael, you got it?
Yes, ma'am.
All right, baby doll. All right, and I would like to splint the patient this way. I kind of like say, get yourself comfortable where you're in a good place, okay? And I want them, let gravity do the work for you. She's going to be in a little bit of extension naturally, okay? Now, typically, in the lab, will have little, we call them China markers or wax pencils. Draw with the wax pencil. But because I don't have one, anybody in here have a Sharpie? Come on, who's the school supply nerd? I knew you would. Tell me your name. Megan. Isn't there another Megan in here? Where's the other one? You're the one from North Carolina? Or? Oh, okay. What's your last name? It's like a... Lynn?
Lynn.
Megan Lynn?
Lynn.
Lynn? L-E-N-T-Z? All right. Thank you, friend. So then trace it onto here. Now, some teachers are going to say, no pen marks. Okay? But here's what is that what you said? Okay. So, all right.
I was pretty much.
So here's the trick to not have pen marks, is draw outside of where you need to draw, and then cut inside of it, and you won't have any dang pen marks. Okay? So you see what I did?
Yes, ma'am.
Okay? All right, got it? Put it in here. Let it get soft. We probably need some more water already, but hopefully we can get through that. So it just takes a minute. I feel like a cooking show. I'm like Rachel Ray or Paula Dean or, oh, she's in trouble, sorry. Didn't mean to refer to her. Although I like her recipes, I must say. So once you get good at splinting, it really doesn't take you much time at all. You guys, it's going to take longer. Be patient with yourself. Some of you are more artsy-fartsy. You're going to be good at splinting. The people who are more heady, kind of awkward, sort of motor people, you're not going to be good at splinting, and that's okay too. We just want a basic level of proficiency, okay? You don't have to be awesome at it. I'm not awesome at it. I'm quick, but I'm not awesome. My splints aren't beautiful, but they're kind of functional, all right? Okay, so now the material, look, it's all gooey, look. It's like soft. You got to be careful that it doesn't roll over onto itself. You take the netting, okay, and some people do this. Certain materials will stick to the towel. And I sort of just kind of cool it down. Some people will, now I'm going to say confident cutting, because if you don't, you're going to get jagga, 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 jagga. Look at that. Look at that on the tape. Jagga, jagga, jagga. You don't want that. Okay? Hold this. All right? So, let's get, oh God, it just got stuck on itself. Oh my gosh, what am I going to do? Look, I never have done this before. Of course, because I'm on video.
It's
Crap.
a good example.
Oh my God, what do I do? All right. I'm going to have to fix it now. Crap.
That's a good example of what not to do.
This material sucks. Oh my
I don't like that
God.
material.
This really stinks. All right. So now remember I said you got curves to deal with? Y'all can come up around here, guys. So where were those Curvy scissors? Now here's the little curve. See right here, this helps get in the curve nicely. Okay? So now look, I screwed up here. Oh my God.
okay.
I'm so upset with my work. I'm going to trim this down because I could just tell that this is going to be too big. And I don't want Miss Rita uncomfortable about my pen marks. So I'm going to cut inside my pen marks so Rita doesn't see them. Because she's not going to wear it if she sees pen marks. Compliance matters. All right, go ahead. Put your arm up here. Okay? Oh, this is crappy.
It's okay.
Okay. So, here's what we do. We roll back like this. Like the Walmart roll back. Okay? And, all right, so I'm going to teach you a little phrase. Stroke it, don't poke it, baby. Okay? So, I want this, I don't want this. This is crappy. If I see fingerprints, like, don't like it, stroke it, don't poke it. Okay? You want to make sure you get the thenar. You got to have this web space so she can still use her hand. Okay? And so we're kind of just doing this kind of movement as, relax your hands, patient. Now, sometimes the patient tries to help you too much. This is a good time to interview the patient and say, Miss Rita, what do you like doing in your free time? What do you do?
Swim.
Swim.
Read.
Tell me about your hands. What kind of activities do you use your hands for?
Play the piano a little.
Oh, okay. So this is important to have this carpal tunnel heal up. Yeah.
And I pet my dog a lot.
Okay, so we have to get your hand back in shape for, kind of so it relieves it. What did the doctor tell you about possibly having surgery?
Well, he told me first, let's do a conservative method of
This
wearing
is conservative.
my splint, and then I'm supposed to go back and see him in 3 weeks after wearing it continually.
Right,
I can take it off to have a shower and then have to put it back on.
right,
And then he might try some cortisone injections.
right. Sometimes they'll try ultrasound or iontophoresis where they drive a steroid medication in there just to reduce that inflammation in the carpal tunnel, okay? All right, so sometimes this isn't beautiful because of my little mess up here. So I would never do that with a patient. I would start over with a patient, okay? Before I get it off the patient, I'll go, all right, well, does this look like it's going to work? Let me mark for straps. Now, so typically we want like a 2-inch, I'm probably driving her crazy because I put pen marks on the splint. Work through it, okay? Emotionally. Okay, so breathe. All right, so we're going to need a 1-inch strap here, 2-inch, and 2-inch. If we didn't have good strapping here, the splint is going to tip this way or tip this way. So we've got to have good straps. So I mark here, and then I mark here. Okay? Now, the next step is, okay, I've got this nice Velcro here, and if you'll plug this in. This is like a hairdryer, but it will burn you really badly. It's like a super high temperature hairdryer. So when you use it, okay, I want you to make sure you turn it on, okay? It gets really hot quickly. Now, as soon as you use it and you're done using it, you kind of like put it to the middle setting, which is cold air. And that helps the heating element to sort of preserve it. So put it to cold as soon as you use it, and then you can just leave it on the counter for your friends. And then when we're done our splinting session, turn them off. When you're done this session, you kind of turn that, to cool. Now, this is like a crappy job, and I'm sorry, I normally do better than this, but no, that's what happens. Okay, so we have our sticky back. This is called loop. This is called hook, okay? Thanks for the space program for inventing Velcro. So this is going to be the 1-inch strap right here to here, and then we're going to do a 2-inch here to here, two 2-inch straps. So just a little trick. Now you tell me about your quirks. Miss Irma, who is on faculty here, hates just squares.
I make them round.
Yes. So Miss Irma, remember I said don't use those kind of scissors, okay? And these scissors, occasionally we got to get goopy gone and get all the gunk off these. But Miss Rita will round these. And the reason they round them
I just do the ends.
is because then it won't peel up, okay? Now, just a little trick, I don't know if you do this, but I do.
I do.
I heat it up.
No, I don't do that.
Okay, so you heat this up. The glue on this, it kind of curls up when it heats. You see it curling? Woo! And heat it up and put it there, okay?
Wow.
That just heats the glue up, basically, and makes it stick better, okay? So you're going to do all the straps, and then, you know, like the cooking show, how they have a finished one? I don't have one. But there's one over there on the cord, actually. So you heat this. And again, I would do what she did, which is round the edges. Now, I want to show you something on the finished version. Right here is a finished version. Notice we rolled this back so that the thumb is free to still oppose and do what it needs to do. All we're doing is positioning the wrist. I'm going to turn this off, they're cold. Positioning the wrist so that this one's probably a little too extended for carpal tunnel. So we want about 10 to 15 degrees. Now, this wasn't made on me. We have shearing happening here. So how might we avoid shearing on a splint? What can we do with the strapping to prevent this? What'd you say? What would happen if you made it tighter, though?
That's not gonna work because the splint is
Could
rigid.
you pad the like arm just in case?
You could pad. I'm not a padder. Are
I'm a
you?
patter.
I'm not a padder
Costs more money though.
because my theory is if you make a good splint, you shouldn't have to pad it. That's my theory. That's just a theory. That's not scientifically proven. It's we all have beliefs. Okay, so it's still kind of moving even though I tighten the straps.
The
So-
placements of the
How
strap,
so?
like not straight across.
Amen, Brother Kobe. Okay? I could go crisscross applesauce and then prevent it. Okay? So there's other options. But all I will tell you is don't make a strap straight across because it has a tourniquet effect and cuts off circulation. You always want to make sure that you can get a finger under a splint or else you have it too tight. You want it to be like that. Okay? I tend to do my straps diagonal, so I don't do crisscross applesauce, but I tend to do placement kind of like that and like this, and that reduces some of the friction. But if you're still getting this business, you might need to go crisscross applesauce. Okay? Are we good with that? You want to make sure here that, you know, it kind of, again, has that one finger under it. We give the patient instructions. Miss Rita, this is your finished product, your fake finished product.
Okay.
Now, this is your splint, and I'm going to have you sit here for around 20 minutes while I work with that patient there, Miss Natalie, and I want to make sure that it doesn't cause red areas. So I don't want you to leave until I check your splint. That's the first thing you do. Secondly, Miss Rita, you can take this off and wash it. Put it on yourself. I want to make sure that you can get it on and off yourself. You always want to make sure that the Velcro is not exposed because like a jersey knit sweater, if I get the Velcro on it, and the first time I get a pull in my sweater, I'm not wearing this. So you want to make your splint as friendly as possible so the person's going to be compliant. Okay? So I'm going to have her sit for a few minutes. I'm going to give her instructions. I'm going to say whatever the doctor's protocol is. Typically, when a person first gets a splint, you're not going to make them wear it more than 2 to 4 hours at a hit. Say, wear it today for 2 hours, and then take it off, and these are the kind of areas where you might get red areas, okay? So over the bony prominences, sometimes under the strap, if you have too much, if you have too much tension on it. I would do what you just did, Miss Rita, which is wear this sleeve under it, because this material tends to kind of make you sweat. So I would wear this under it, particularly in the summer. Do not leave this in your car because it'll melt in this hot summer. Take it off when you take a shower. And again, if there is any red areas, any discomfort, you feel like it's not doing what it needs to do, you call me back and you make an appointment and we'll readjust it. It's not a problem. Sometimes you're swollen when you come in today, and then, tomorrow you're not swollen and the splint fits differently. So it is no problem to just call the office and make an appointment and come back in. You're welcome. Do you have any questions?
No, I think you answered them all.
Would you mind repeating back the instructions for me that you heard?
Well, do you have this written on a piece of paper?
I do. I have a handout for you, but why don't you tell me what you heard?
Well, you don't want me to put my straps too tight because I can cut my circulation off. It would be like a tourniquet. Just wear it for a couple hours. Check my skin to see if there's any red and pressure areas that maybe the splint needs to be adjusted. And if so, then I can give you a call. You'll fit me into your busy schedule.
How'd she do? Did she pretty much right? Okay. So that's the instructions. Now, how am I going to document it? Miss Retha, patient was fitted with a customized wrist cock-up splint to alleviate pressure on the carpal tunnel. She was instructed in splint care and wear the splint initially 2 hours, building up to 4 hours, and within a couple days to wear it at night, because lots of times carpal tunnel, people sleep like this and it gets worse at night, or wear it when she's in the kitchen maybe, or wear it when she tends to have worse symptoms, right? Patient was instructed to contact me if further adjustments are needed in the splint or if any problems should arise. Patient will return in 1 week and begin, or maybe 2 days, and begin physical agent modalities and gentle range of motion techniques. And we might write a couple goals. Does that make sense? Splint notes are easy because they're quick, they're like a paragraph. You all, after you make a splint today, okay, what I want you to do is give me give Tamara a little patient history. So patient is a 23-year-old student. She reports she is doing lots of computer work lately, and all of a sudden she appears to have carpal tunnel syndrome. Doctor instructed her to start with conservative treatment, with splinting and physical agent modalities. Today a splint was fabricated. You always ask the patient about their pain level. Okay? On a scale of 1 to 10, what's your pain like?
Well, usually during the night it wakes me up, and it's probably about a 6 or 7.
6 or 7. What is it right now?
Right now it's probably about a 3.
Okay. And is the pain like tingly, or is it like dull, achy, throbby?
Maybe like a little burning.
Burning. Okay. All right. So every time they come in, you want to ask them about the pain number and something qualitative about that pain. Sharp, dull, achy, throbby, whatever burning, she said, I'm going to document that. Does that make sense? So that each time, hopefully that pain level goes down. Questions?
Can I just add one thing?
Yes, ma'am.
Usually what I document too is that patient exhibits a good understanding
Yeah.
of the ATP through
What's
demonstration.
ATP?
ATP is the home exercise program, or splint wear and tear.
What does that stand for?
ATP?
Oh, HEP. I thought you said ATP. I was like, that's like a
That's a security
biochemical,
system.
isn't it? Yeah. That's a DNA thing.
Just
So-
because whenever I verbalized it back to you,
Yeah?
I understood
Yes.
it.
You want, because if they come back and say, this splint, that's my arm up. Well, you know they left there repeating back what the instructions were. So HEP, Home Exercise Program. Okay? Are we good with this? All right. So when you get to the lab later today, okay, you're going to get right to work at tracing, marking, cutting your pattern, and then in the lab we have some pre-cut squares. But folks like David, the pre-cut squares are probably not going to fit on the guy hands. So I'm going to show you how to cut the material with the razor. I'll do that at the beginning of the lab, so you all know how to do that. You just have the advantage of somebody kind of pre-cut these little squares for you. Okay? All right. So, no splint. This when I'll yell at you. I'll yell at you when you're not using the right scissors. I'll yell at you, stand up. So you do this, and you go like this, and then you're splitting the patient in midair. What the heck is that? Don't do it, okay? Probably that's the only ways I'll yell at you. But it's like a mom kind of yell, okay? The mother still loves you, all right? All right, I think that's it. You can go back to your seat. You can stop taping. Good job.